Hello, my name is Jessica, and this is my final assessment for Intro to Health Assessment. I have my patient here with me, Mr. Gaffney, and today I'm going to be doing his assessment. He's a 36-year-old male. For the sake of time, I've already done a few things. First thing I want to do is introduce myself to my patient. My name is Jessica. I will be your nurse today. I'm going to be doing a head-to-toe assessment. This involves a lot of touching. If anything makes you uncomfortable or causes pain, just let me know. Okay? As a nurse, the first thing that I would do when I come into a room is wash my hands. Since I don't have a sink available to me for this video, I will be using hand sanitizer today. Okay, for the sake of time, as I said, I did do a few things in advance. This includes my vital signs. My blood pressure was 110/76. Heart rate was 64, and respirations were 16. First thing I want to do is go to Mr. Gaffney's hands. As I'm looking at the hands, I'm also feeling to make sure that the skin is warm to the touch, which it is. I am looking for any bumps, bruises, blemishes, lumps. Everything looks normal here. Nails are clean. Cap refill is under 3 seconds. Everything looks normal in this area, and his skin tone is appropriate for his ethnicity. Next, I'm going to come to his head. Here, I'm looking for dandruff, and I'm feeling for any lumps, bumps, or bruises here. Any lumps, bumps, or trauma. I don't see anything here. Everything looks normal in this area as well. Next, I'm going to come around and go to his face. Hold your head up a little bit for me. What I'm checking for here is that his eyes are symmetric, his nose is midline. Everything looks normal in this area as well. Okay? Next, I'm going to palpate his temporal carotid and his thyroid, temporal carotid arteries and his thyroid. And I'm also going to listen to those with the diaphragm of my stethoscope. So, the temporal arteries are strong. The carotid arteries as well. With the thyroid, I don't feel any mass or anything there. So the arteries are strong, and I don't feel any lumps or masses in the area of the thyroid. When I'm listening for roots in these areas. And we're good there, no roots in any of the areas. Okay, next thing I'm gonna do is look at the trachea, and it is midline, which is normal. Could you swallow for me? Okay, stays midline, and that's normal as well. Next, I'm gonna check the TMJ. I need you to open your mouth and close it. Can you open it and move it side to side for me? Everything normal there as well. Next, I'm going to check the lymph nodes. First lymph node is the occipital, the pre and post auricular, the submental, submandibular, and then I'm going to move down into the cervical chain and the supraclavicular. So the occipital starts in the back here. I don't feel any hard nodules or nothing feels swollen, which is what I'm looking for when I perform this part of the assessment. Okay, so everything looks normal there. Okay, next I'm going to get my pen light here. And I'm gonna check the pupils. What I'm checking for here is that they're 3 millimeters in diameter, they're round, they're reactive and accommodating. So if you can look straight ahead at me, Mr. Gaffney. Just hold your head up. And they are. So everything is normal in that area. Next, I'm going to do my cardinal and peripheral vision test. And what this is going to check is his cardinal and peripheral vision, of course. So, if you just hold your head straight up and just follow my pen with your eyes, don't move your head. Okay, and for peripheral, maybe we should move this to the side. Turn to the side for me. So that she can see what I'm doing better. Okay, and for peripheral, I want you to tell me when my pen comes into view for you. Just say now.
No. 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 No.
Okay. Next, I'm going to do the Snelling chart. You can stand up for me, Mr. Gaffney, and stand back here. He's gonna stand back at the line. He may be a little out of view for the camera, but my tape is fur back. So you stand here. And I want you to read the smallest line you can see for me here.
F D F L T C E C.
You said FD?
Yeah, F D P.
Okay. Alright, so he is at the I guess it's this one, but you got it kinda wrong. Can you read the closest one you can see clearly?
L E F O D F C T.
Okay, so you're at 1520. Alright. Thank you. Next, we're gonna do the close-up vision. You can read the smallest line you can see on there.
L O P F Z E D C T.
Okay, so you're at 2020 there. So 1520 and 2020. Alright, the next thing that we're gonna do is the spine. If you can stand back up for me, Mr. Gaffney. And he's standing up straight, which is good. That's the first test. You can see it when they're walking. The next, we're going to just make sure that the spine is straight, no curvatures there. If you'll bend over for me, just straighten it. I'm checking for any curvatures. Everything looks normal with the spine. Thank you, sir. You can have a seat. Next, I'm gonna palpate and check the ears. Here, I'm looking for any drainage. And I'm also looking for any bumps or bruises that I may have missed while I was doing the head. Ears are soft but firm, which is normal. I don't see any drainage or anything abnormal about the ears. Next, I'm gonna perform the whisper test. Mr. Gaffney, what I'm gonna have you do is just repeat what I whisper to you. Say it loud.
1, 2, 3. A, B, C.
Okay, everything is normal with the ears. Next, I'm gonna do the mouth, and I'm gonna have you open the mouth. Stick your tongue out for me. Okay, can you open the mouth? Say out. So the uvula moves up and down normally. The tongue is normal as well. Open your mouth. I see a few missing teeth. I don't see any caps or anything. When was your last dental checkup?
Last month.
Okay, so he is regular with his dental checkups, which is good because the dental part of your well-being is connected to your heart well-being as well. Okay, next. Okay, next I'm gonna look at the nose. If you could just breathe in and out for me. Just look up and make sure I don't see any drainage. He's not congested or anything. I don't see anything abnormal. I'm gonna check the sinuses since I am in this area, and I'm gonna check the maxillary and the frontal sinuses. So what I want you to do is let me know, if you have any tenderness in these areas. Tenderness? Tenderness? So the sinuses are normal. Next, I'm going to move to this, his sense of smell, and I'm gonna have you close your eyes, and I'm going to place my hands in front of me, and you just let me know what you smell. And it's customary that we use a common smell so that it's something that the patient will recognize.
Hand sanitizer.
So he did recognize that it was my hand sanitizer, and that is good. The next thing I'm going to do is the breast exam. And most men don't know that this is an important part of the exam for them because they associate breast cancer with women. However, it is common in men as well. So I'm going to show you how to perform your breast exam method. Okay? So what I do is have you lift either arm behind your head. And what we're going to do is just palpate down with the cuffs of your 3 fingers, the padded part of your fingers, okay? And you just come around. And you're feeling for any hard lumps, bumps, or bruises, lumps or bumps. Okay? So you try that for me with your hand behind your head. Well, you want to start here. Yeah, and use the padded part and just come around like you're going around a wheel. And go up. Okay, we'll do the same for the other side. You push your hand behind your head. Okay, you try that side. Now I don't feel any bumps or lumps in this area, any hard nodules, so that is good. Next thing I want to do is check the axillary because there are lymph nodes in that area that we also need to check. So if you'll place both of your hands behind your head, and I'll just go. And again, I feel no lumps or bruises. Thank you, Mr. Gaffney. Okay, next I'm gonna move to the thoracic exam. And while I was doing the breast exam, I was starting this part of my assessment to make sure that his breathing pattern is normal. He's not laboring to breathe. There's no barreling of the chest. Excuse me. There's no barreling of the chest. His chest is moving evenly as he breathes, and that is normal. So the next thing I'm going to do is with the diaphragm of my stethoscope, I'm going to listen to his S1 and S2 heart sounds, and I'm listening for murmurs, gurgling, anything abnormal in that area. Okay, and at the apex of the heart, I want to compare that sound with his radio pulse to make sure that everything is even there. And it is. The next thing I'm gonna do is listen to his S3 and S4 heart sounds with the bell of my stethoscope. And here I'm gonna be listening for murmurs, gurgles, or clicks. Everything sounds normal there. That concludes the thoracic. Next, I'm going to move to the vascular part of my assessment. And I've been assessing the skin throughout, so I kind of know what I'm working with here. His skin is warm to the touch. His skin tone is appropriate for his ethnicity, which is good. Move down to the legs. You can remove those for me. The hair, no, socks are fine. His hair is distributed evenly. I don't see any superficial or varicose veins. I do see an area that looks like dry, cracked skin that's in the shape of a circle, and there's a few of those. So I would report that finding to the doctor so that they could assess that further and possibly treat it if necessary. And it looks like it's just on one leg. And you said in your pre-assessment that you had knee surgery. Which knee was your surgery on?
What?
Okay, because I don't see the scar on there. He did have knee surgery. Okay. He did have knee surgery on his right knee. And I do see a small scar that is a result of that surgery. But I don't see any swelling, no edema, anything like that in this area. Okay. Next, I'm going to move to the pulses. I'm going to start with the peel pulses. Remove your socks for you here. They are strong. Then we go to the popper side. Strong there as well. Into the brachial. The radial. And I checked these earlier and they are strong in the brachial. Those are strong as well. Let me put your socks back on. Okay. So I don't have a hammer, so I am going to use the bell of my stethoscope in order to perform the deep tendon reflexes. And I'm going to do those in the knee and also at the back of the arm and at the front here. Here. Okay, everything is normal in that area. Alright, next I'm gonna do the neuro assessment. Now, throughout this assessment, I have been performing my Glasgow coma scale on him, so I know that his eyes are open. That's 4 points already. He's oriented to time, place. That's 5 points. And he has been following every command that I've given him, so that's 6 points. If we total that up, that is 15, which is the normal for Glasgow coma scale. Next, I'm gonna do sensation, and at this part of the exam, what we're gonna do is dull versus sharp. I'm gonna have Mr. Gaffney close his eyes, and he's gonna let me know if the sensation is dull or sharp in the area on which I perform the assessment. You ready? Let me know if you feel any pain or anything uncomfortable. Close your eyes.
The
Which area?
ankle. Sharp.
Which area?
Ankle. Sharp. Forearm. Forearm.
Okay, you can hold your head up for me. I'm gonna do the face. And it's appropriate to let him know that you are moving to the face because you don't, their eyes are closed and you don't wanna just shock them by poking them in the face. So I have let Mr. Gaffney know that I will be moving to the face, and if you would just let me know what you feel.
Sharp. No.
Okay, everything is normal as far as sensation. Next, I'm going to check his grip. If you'll just squeeze my hands. Alright, I'm gonna move on to the musculoskeletal assessment, and I'm going to check that he's able to perform a few things for me in this area. If you'll push down on my hands for me. Okay, if you'll hold your legs out. Don't let me push them down, okay? Okay, that's normal. Now I want you to push down on my hands with your feet. Alright, everything is normal in that area. Next thing I'm gonna do is the cranial nerves. This is another part that I have been performing throughout my assessment. So, the first cranial nerve is the olfactory, that's the sense of smell, and we did that with the hand sanitizer, which he got correct. The next one was the optic, which is the vision, and he did the peripheral and cardinal vision test for me, and he got those correct. Next is the ocular, trochlear, and the abducens, and that was the cardinal field assessment. The trigeminal was the TMJ, which he opened his mouth and moved side to side. The facial, I'm gonna perform that now. I'm gonna have him do 3 things for me. He's gonna smile, he's gonna puff out his cheeks, and he's gonna raise his eyebrows. Can you smile for me? Puff the cheeks out. And raise your eyebrows. All great. Next is the acoustic. We performed the whisper test. The glossopharyngeal. We had him say ah and stick out his tongue, but I'll have him do that again. Say ah for me. Stick out your tongue for me. Perfect. The vagus was when he swallowed, when I was checking the trachea. The accessories, I'm gonna have you, can you just shrug your shoulders for me? Shrug them light. Just a normal shrug. Okay. Normal in that area. The hypoglossopharyngeal is, I'm gonna have him put his tongue in his cheek, and I'm gonna try to push that in. I'm gonna do that on each side. Okay, put your tongue in the cheek for me. Push other side. Okay, great job there. Next, I'm going to perform a test where I'm going to place, this is going to test for Tassie. I'm going to place the objects in his hand. These are going to be normal objects that are around the house that he should know the feel of, and he's just gonna let me know what I placed in his hand. You can close your eyes for me, Mr. Gaffney. Can you tell me what that eye was doing?
That's fine.
Okay. Second object.
Pencils.
Thank you. And that was normal as well. Next, I'm going to draw numbers in his hand, and I want him to tell me which numbers I'm drawing in his hand, and he should be able to do that. You gotta close your eyes.
3, 8,
That was normal as well. Next, I'm going to do the rapid hand test. And what I want you to do is put your hands on your thighs and move them rapidly. Can you keep it short for me? That is normal as well. Next, I'm going to have him hold his arms up for me. Straight out. And I'm gonna let him go and just make sure they don't sway or drop or anything. And he's able to do that normally. Next, I'm gonna do the Romberg test. If you stand up for me, Mr. Gaffney. And how we do this test is I'm gonna have him stand with his feet together, hands by his side. And what I'm looking for, you don't have to be funny, just normal. And what I'm looking for is any swaying as if he's gonna fall or anything, and he's perfectly still. I don't see any swaying, which is good. Next, I'm gonna perform the heel to toe. So if you'll turn this way for me, you're gonna walk towards the camera, and you're gonna do heel, toe, until you reach the camera for me. Perfect. He was able to do that normally. You can have a seat for me, Mr. Gaffney. Next part of the assessment, thank you, is going to be, I'm gonna put my finger in front of him, and with one finger, I want you to, this one first, I want you to touch your nose and then touch my finger. Nose, finger, nose, finger. Thank you. And we're gonna go with the other one. And that's normal as well. The next thing that we're gonna do is the vowel sounds. Now, for this part of the assessment, I am gonna move a little differently in my order. I want to listen first because once I start to palpate, his vowels are gonna start having more sound to it. So we don't want any artificial sounds as part of the assessment, and we classify them as hyperactive when they wouldn't normally be there if we hadn't palpated. So what we're gonna do is start with auscultation. So, Mr. Gaffney, we're gonna move around a little bit so that you can get a clear view of this part of the assessment. Okay, I'm gonna have you lay here, Mr. Gaffney. You'll just lay your head down. Okay, so what I'm listening for is vowel sounds. I'm gonna use the diaphragm of my stethoscope to listen to the 4 quadrants for the vowel sounds. And then I'm gonna use the bell to listen to the aortic, iliac, and the renal arteries. We're gonna start with the diaphragm. You let me know if anything is happening. Okay, his vowel sounds are normal. I heard a few, about 1 or 2 sounds in each area, which is normal. They're not hypoactive or hyperactive, which is what we're looking for when we're performing this part of the assessment. So everything is normal in that area. The next thing I'm gonna listen to, as I said, is the aortic, the renal, and the iliac arteries, and I'm using the bell of my stethoscope. We'll start with the aortic. Moving on to the renal. And down to the iliac. Okay? Okay, everything is normal in that area as well. Next, I'm gonna palpate for the liver, which I should not feel. And, hey, do you have any hernias or any trauma to this area? Any history of surgeries or anything? So you haven't had anything removed such as your gallbladder or your appendix, nothing in that area?
No.
So Mr. Gaffney doesn't have any history of surgeries or anything in this area. I should not be able to feel his liver when I palpate. I'm just gonna firmly touch around and palpate around the abdomen. I was not able to feel his liver while palpating, which is a really good sign because we know that it's not swollen, and we know that it's not enlarged, and it's not hardened or anything. So that's a good that's a good thing for Mr. Gaffney as well. This concludes my assessment. Thank you.